Hi guys! Before I start this video, I have included a chart summarizing the Ministry of Health's vaccines, which are Moderna and Pfizer, for the adult and pediatric population. And the pediatric population consists of those that are ages 5 to 11 years old. For the purpose of this video, I will only be talking about the Pfizer vaccine. So just a little bit of a disclaimer because I know I didn't show this within the videos that I'm about to show, but all preloaders are expected to perform hand hygiene and gloves are optional. We want to inspect the vials with the vaccine visually for foreign particulate matter such as the vial's rubber stopper, discoloration, damage, and contamination prior to reconstitution or preloading. If any of these conditions exist, the vaccine should not be used, and the preloader will notify the preload lead and cold chain manager and inform the vaccine management team. We want to make sure that we are inspecting the diluent vials and check that it is sterile 0.9% sodium chloride injection, and we will use one diluent vial per vaccine vial. We also perform checks for vaccine and diluent by looking for right vaccine product, right diluent, expiry dates, and lot number, which would match the stickers that we are given. So firstly, I'm going to be talking about how to make the adult dose for the Pfizer vaccine. The first step is to remove the diluent vial cap and use strict aseptic technique to clean vials rubber stoppers using friction with an alcohol swab. You want to allow the rubber stopper for the diluent to air dry and discard the alcohol swab after you have completed this. You do not want to fan with the hands or objects. Next, you want to attach and secure 3 ml syringe to 25 gauge straight needle and withdraw 1.8 milliliters of diluent, also known as 0.9% sterile sodium chloride, using the straight needle into a 3 ml syringe. After you have completed this task, you want to perform a quality check with another member to ensure that you do have 1.8 ml of diluent. As you can see here, I am trying to get rid of the air bubbles inside this syringe. So you can either do this by tapping on the syringe with a pen, or you can pull the plunger back just to get rid of these air bubbles. After a quality check is performed by another member, I can now move on to the vial containing the vaccine. So same thing as before, I am cleaning the vial cap using strict aseptic technique and using friction with an alcohol swab. What I am doing now is I will now puncture the vaccine vial using the pre-drawn diluent and ensure to record the puncture time and vial number on the vaccine prep documentation log. Upon puncture, I want to make sure that angling the needle towards the wall of the vaccine and slowly injecting the diluent, and this should take approximately 10 seconds in length. I'm then withdrawing 1.8 milliliters of air from dead space into the empty diluent syringe before removing the needle. I'm making sure that I am not removing any vaccine within this process, and this will help to equalize the vial pressure when preloading the reconstituted vaccine. I then withdraw the needle from the vial and discard the needle and syringe into the sharps container. I'm now gently inverting the vial 10 times to mix the reconstituted vaccine to achieve a more uniform suspension. Afterwards, I am now withdrawing the vaccine from the vial into my syringe. If air bubbles are present, I have to remember not to flick or tap the syringe during and after preloading. Instead, I will push the vaccine back into the vial and withdraw again or pull back on the plunger like I am doing right now. Next, I am scooping the needle cover onto the straight needle, pointing the needle to the ceiling and pressing down to recap. I then pull the syringe plunger back to ensure that no dosages will be lost within this needle. I'm going to be using this lure-to-lure connector, which makes it easy to transfer contents of the vaccine between two different syringes. So with this 3 ml syringe, I will be withdrawing 0.3 ml of the vaccine into 6 different syringes, which is what I will be doing now. And I will be repeating this step 6 times. Each vial contains enough vaccines for 6 doses. Again, you will see me pull the syringe plunger back just to ensure that no doses will be lost within the needle. Tell me what you write.
sit down when the lights are low? Will you hold me down? Let me know. Can you ride for me? Making assumptions, gon' lead to destruction. Making a whole wave, it don't come with instructions. Been under pressure but never folded. I kept my circle intact but I feel it closing.
Next, I am attaching a new 1-inch 25-gauge safety engineered needle and priming the needle to ensure that there is a 0.3 ml dose. You may see me inverting the syringe and pulling back on the plunger just to get rid of the air bubbles that may be within the syringe, as I am not able to flick or tap the syringe containing the vaccine. Afterwards, I attach a vaccine and diluent label, and these are usually blue and green in color for the adult dosages, and I'm ensuring that I'm not covering the dose margins. The labels will contain vaccine details needed by immunizers to accurately document administration details within our documentation system. I have checked the vaccine sticker for vaccine name, lot number, and expiry date, and the diluent sticker for diluent type, lot number, and expiry date. And I will be repeating this for the next 5 doses.
Will you be there when it go down? Either you can show up or you back down. Is you really riding? Let me find out. Should've wish I knew that when I know now. No type of distance can make me feel alright. I know where we stand, I'm here to stay. With you right for me. Ain't no picking sides, switching sides on me. When the chips are down, when the lights are low, when you hold me down, let me know. Can you ride for me?
I will then bring a basket or tray of the preloaded syringes to the preload lead, who will complete a second quality assurance check before releasing them towards the vaccine runners. I also write down the time that I punctured the vials, as well as how many doses I was able to retrieve from the vial. So moving on to the pediatric dosages for the Pfizer vaccine, which has an orange cap and is different from the purple ones for the adults, I am now going to be showing you that I have already drawn 1.3 milliliters of diluent within a 3 ml syringe to a 25 gauge straight needle. I have already performed a quality check with another number. I am using aseptic technique to rub the rubber stopper of the vaccine vial with an alcohol swab. And I am puncturing the vaccine vial using the pre-drawn diluent and ensuring to record the puncture time and vial number on the vaccine prep documentation log again. I am now angling the needle towards the wall of the vaccine and slowly injecting the diluent while withdrawing 1.3 milliliters of air from dead space into the empty diluent syringe before removing the needle. I am now gently inverting the vial 10 times to mix the reconstituted vaccine to achieve a uniform suspension. I'll be now using the 3 ml syringe with a straight needle to retrieve the vaccine from the vial, and I'm just pulling back on the plunger, ensuring that I am retrieving every last drop of the vaccine into this syringe.
I ain't never been that tired of being in or out, but when I speak out loud, gotta hear me out. You ain't gotta take your words and put them.
I then recap the needle and twist it off, putting this within the sharps container. I pull back on the plunger to ensure that no vaccine will be lost within the needle, and I will attach the lure to lure connector again. Because this is a pediatric dose, I will now be using the 1 ml syringes and withdrawing 0.2 ml. Now, in this sense, I will be withdrawing 0.2 ml of the vaccine into 10 syringes. Each vial contains enough vaccines for 10 dosages, as opposed to the adult one, which withdraws 0.3 ml of the vaccine into 6 syringes. I will be repeating this step 10 times. I also ensure that after I remove the syringe from the lure-to-lure connector, that I am pulling the plunger backwards just to ensure that no dosages of the vaccine will be lost.
I'm in my mouth, 'cause baby, without a doubt, I'ma be there when it go down. Make you believe in love you've been talking about. Don't get a second guess it. You're the only one who gets it from me. Whatever you need, you ain't even gotta repeat it.
Tell me what you write for me. Ain't no picking sides, switching sides on me. Oh, with the chips are down, when the lights turn low, when you hold me down, let me know. Can you ride for me, for me?
I then attach a new 1-inch or 5/8-inch 25 gauge safety engineered needle and prime the needle to ensure that I do have 0.2 ml dosages. In this sense, because the lid of the needle is pink, I am using 5/8 of an inch of a needle, and these are usually smaller than the 1-inch ones. Same thing as before, I'm attaching vaccine and diluent labels, which are the colored stickers on each syringes, ensuring that I'm not covering the dose margins. Because this is a pediatric dosage, the stickers are now orange and green. The labels have the vaccine details needed by immunizers to accurately document administration details within the documentation system. So again, the vaccine sticker has the vaccine name, lot number, and expiry date, and the diluent sticker has the diluent type, lot number, and expiry date. And I will be repeating this 10 times as I have 10 dosages right now.
Even in the dark, girl, you be shining. Flawlessly and perfect. You ain't even trying. Keep it on that low key, like a hidden talent. You got no intention, just going with the motions. You be shining, 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 girl, you flawless. You be shining, shining, shining with no effect. You be shining, 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 you perfection. You be shining, 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 no intentions. Girl, you stay shining like them diamonds in the dark, yeah. No, we be worlds away, you shining from my fire. I wish this system went missing, that it's true, you not your Texas. We go back to that roots up and I finish, but we started. I feel them goosebumps on your spine, you be tensing up your thighs, and you're grabbing in my arms, girl, even in the dark. You be shining, 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 girl, you flawless. You be shining, shining, shining with no effect. You be shining, 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 you perfection. You be shining, 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 no intentions. Girl, you stay shining like a beacon in a fog, yeah. You my muse, we got mutual understanding. You understand me like nobody else. These days, people go too soon, so I'ma love you like nobody else.
Now that I have 10 doses, I'm going to bring the basket or tray of the preloaded syringes to the preload lead, who will complete a second quality assurance check before releasing the doses to the vaccine runners. And attached to this is just a clip of the 0.2 ml pediatric dose syringe. And that concludes the video. Thank you so much for watching, and I hope you guys learned something.